Hey there, I'm Madison Splan. I'm a women's clinical specialist through the American Physical Therapy Association and work with Mountain End Physical Therapy in Murray, Utah. Today, I'm going to describe how to do a Kegel. So this is for all those ladies out there that have problems coughing, laughing, sneezing, or jumping on the trampoline after you have a baby. Just so you know, you can do all those without peeing your pants. You just have to strengthen your pelvic floor first. So, here's how you do it. I think one of the biggest misconceptions is that a lot of people will hold their breath when they try and do a Kegel. That is wrong. We actually want to do it while we're breathing out, and here is why. Our diaphragm and our pelvic floor relate together. When we breathe out, they both draw up. When we breathe in, they both draw down. So again, we want to coordinate with breathing out. Another reason we want to breathe out is because that's what we're doing when we cough, we laugh, or we sneeze. So we're creating that muscle memory between our brain and our pelvic floor. So here's an example. What you want to do is take a deep breath in. And as you breathe out, you squeeze your pelvic floor. What that feels like is you're pulling your muscles up and in. And those muscles are the muscles that you would feel if you're sitting on a bicycle seat. They're not your big glute muscles that you can clench. They're very small muscles. Again, just the muscles that you would feel if you were sitting on a bicycle seat. And again, you want to take a deep breath in, breathe out, and squeeze, trying to hold for about 3 seconds. And I would encourage you to try and do these 5 sets in a row, 10 times a day. You want to try these in different positions, in sitting, in lying down, in standing. You want to practice how you play. So whatever positions you feel like you have the most difficulty in, that's the position that you want to practice these in the most. So please visit www.mlrehab.com to find a specialist near you. Thanks.